Hello, my clinical presentation is on a 15-year-old female who presents to the clinic with a bump on her inner lower lip. She is accompanied by her mother. Patient states that she has had this bump on her lower lip for a few months now. She does not remember any specific trauma that may have happened to her lip to cause this type of sore. Review of systems. In general, the patient is age appropriate with no developmental concerns stated by herself or mother. No unusual weight gain or loss, no temperature sensitivity, no general malaise or fatigue. Mother and patient deny any rashes or concerns with hair, petechiae, or itching of the skin. Head and neck, patient denies any head pain or injuries, no stiffness, no masses. Eyes, ears, nose, and throat. Patient denies throat pain or discomfort, denies any sores or lesions besides the bump that is on her inner lower lip. Patient denies any eye pain, no itching, no redness, no discharge, no swelling. Patient also denies any ear pain and or discharge, no nasal congestion, nosebleeds, rhinorrhea, or sneezing noted by patient. Respiratory, patient denies any respiratory concerns, no dyspnea, no wheezing, no cough. Cardiovascular, patient denies any abnormal history, no palpitations, no syncope, no chest pain. Gastrointestinal, patient denies any complaints of nausea and or vomiting. Patient denies any abdominal pain, no nausea, no diarrhea, no bloody stools, no constipation. Genitourinary, patient denies abnormal history or concerns, no dysuria, no increased urge or frequency, no hematuria, and no discharge. Musculoskeletal, patient denies any abnormal history or concerns, no pain in the joints, no decrease or limitation in range of motion, no joint swelling. Neurological, patient denies any abnormal history or any history of migraines or seizures. Patient denies any abnormal endocrine history or concerns. Patient denies abnormal history or concerns having to do with bleeding, no easy bruising or swollen lymph nodes noted by mother or patient. Psych. Patient and mother deny any issues, no anxiety, no depression, no difficulty sleeping, no hyperactivity or difficulty focusing in school and or at home. The patient is currently not taking any medications. She has no known drug allergies and no other allergies besides seasonal. Past medical history, mother denies any past medical problems or hospitalizations since the patient's birth. Family history, mother denies any abnormal family history as well. This 15-year-old is a freshman in high school. She enjoys going to school. She says she has lots of friends, and mother denies any concerns with her social history as well. Working differentials that I came up with for the bump on her inner lower lip were a fever blister, also known as herpes labialis, a kink or sore, also known as aphthous stomatitis or aphthous ulcer, and lastly, a oral mucocele. Objective. So vital signs for this patient: her temperature was 97.4, weight is 74.2 kilograms, so she falls within the 94th percentile. She is 161 centimeters tall, which puts her 44th percentile. Her BMI is 28.5, which places her in the 95th percentile. Upon her physical exam, in general, the patient is pleasant and helpful, no developmental concerns noted. Eyes, ears, nose, and throat. Eyes, her sclera is white, conjunctiva clear. Pupils are perla, 3 millimeters bilaterally. Extraocular movements are intact. Ears, external appearance is normal, no lesions, redness, or swelling. Otoscope exam is within normal limits. Tympanic membrane is clear. No redness noted, no fluid, no bulging. Hearing is intact. Nose, it appears normal. No mucus, inflammation, or lesions present. Nares are patent. Septum is midline. Mouth is pink. Moist mucous membranes, no missing or decaying teeth. She does have braces noted to the top and lower teeth. She has a 0.5 centimeter round solitary fluctuant swelling, ulcer-like sore, noted on the inner aspect of the lower lip at the right central incisor region. Her throat is clear with normal uvula, pharynx, and tonsils. No lesions present, no ulcers, masses, or exudate present. Respiratory, even and unlabored, clear to auscultation bilaterally with no wheezes, rales, bronchi, or retractions noted. Cardiovascular, no thrills, bruit, or murmurs auscultated, normal sinus rhythm upon auscultation. No lab tests were done at this time. Assessment. Patient was diagnosed with an oral mucocele, ICD-10 code K13.79. This was diagnosed because of a ½ centimeter round solitary fluctuant swelling of the ulcer-like sore noted on the inner aspect of the lower lip at the right central incisor region that has been present for a few months without any improvement for the patient. The differentials, fever blister, positive or pertinent, was the size and the look of the ulcer-like sore on the inner lip. Refuting data is that it has been present for a few months with no improvement. As well as the canker sore, also the ulcer-like sore was a positive point to that, but the refuting data, the fact that it has been there for a few months with no improvement. No medications were ordered at this time. Instead, the patient was referred to ENT for further evaluation and treatment. The patient was instructed on how she could gargle with warm salt water, and that could help relieve pain and swelling, and also educated on wearing wax on the parts of her braces that may be rubbing on that part of the lower lip that can also help cause an oral mucocele. Follow-up, the patient was instructed to return to the clinic if necessary, but to make sure that she follows up with her ENT appointment. Again, patient was educated on importance of oral hygiene and ways to reduce lip trauma, especially from braces. As far as clinical guideline, I had a hard time finding a specific clinical guideline for treatment of an oral mucocele within the pediatric clinic. I did find treatments that I guess would happen within an ENT setting. So I do believe that this is why the patient was referred out to ENT. These type of treatments had to do with surgery and or draining, which is not something that would be done within the pediatric clinic. Other non-surgical treatments included medications and corticosteroids, which again, upon talking to my preceptor, he felt, and I understand why, that this is more in the realm of ENT to deal with the oral aspect of the patient, making sure that they know the correct ways to treat it, and if their treatment non-surgically doesn't work, then they can go ahead and do surgical treatments as necessary. So for my debriefing, I do think that maybe since the patient was previously seen by the pediatrician before I was in clinic, he told me that he never did prescribe any type of antibiotic or ointment or anything to put on it. It was kind of a wait and see method. I wish I had been able to be there from the beginning to have seen how it started out and how it looked now. He said that it did get a little bit bigger. But I do think that he did the right thing by referring out to ENT for further treatment.